now you have red blood cells and other components of the blood spilling out of the torn capillaries that don't typically spill out of the intact vasodilated capillaries that you would see with, say, something just caused by a pathogen, or I should say inflammation just caused by a pathogen. And obviously, tearing through soft tissues with injuries is also going to come with some additional pain. But again, in either scenario, bringing the white blood cells to the site of injury or infection is one of the most important parts of this story. So much so that we actually even have a second wave of white blood cell troops sent to the tissue. Within a few days of inflammation starting, a white blood cell known as a monocyte will come from the blood and enter into the inflamed tissue. Now, you might be thinking this monocyte is a completely new cell, but you have met this cell before, but in a different form. You see, a monocyte is kind of like your Bruce Banner to the Incredible Hulk, because once the monocyte squeezes through the capillary and enters the inflamed tissue, it says to the inflamed area, "You won't like me when I'm angry," because I totally imitated that voice correctly. And it starts to get bigger and bigger and angrier, and it becomes a larger Incredible Hulk macrophage, smashing and engulfing every bacteria, virus, necrotic tissue, or other foreign particles in the tissue. Yes, that was a little dramatic, but the point is, again, a monocyte is essentially a macrophage, and this is how it was taught to me when I was a wee high school lad, that a monocyte was kind of the Bruce Banner to the Incredible Hulk macrophage. So hopefully that kind of helps you remember that. But when we have this monocyte getting bigger and becoming a macrophage and entering this inflamed tissue, this is important because macrophages are more powerful phagocytes than neutrophils, often capable of phagocytizing as many as 100 bacteria. Macrophages also are capable of engulfing dead particles, larger particles than neutrophils are, whereas neutrophils can only usually engulf or phagocytize about 20 bacteria before the neutrophil becomes inactivated and actually dies. But macrophages, after digesting particles, can extrude or get rid of the residual products of digestion and often survive and function for many more months afterwards. Macrophages also play an important role in initiating the development of antibodies. However, that is a topic for a whole other video. But neutrophils are still very important to this process because remember, step one to this whole process was those tissue or resident macrophages that were already stored in our tissues, and this allowed for an immediate response. But those tissue macrophages were only stored in a small amount. So we called for backup in step two, and that was those neutrophils. And the reason this is so important is because our body has many more neutrophils circulating in the blood than we do monocytes. And so this allowed for that first wave of backup, those neutrophils, to get to the inflamed tissue within about an hour to help hold down the fort, so to speak, until our red bone marrow could start making more monocytes. And it takes a few days to build up a significant amount of monocytes, so again, those neutrophils are significant in those early stages of inflammation. And so now what? We have these macrophages and neutrophils engulfing pathogens, dead cells, tissue particles, and debris. What happens when this mess is cleaned up and everything's been engulfed? How does inflammation resolve? Well, this is where your lymphatic system plays an important role. In your tissues, you have another type of capillary called a lymphatic capillary, shown in green here. And these lymphatic capillaries are important because they are even more permeable than the blood capillaries, which makes it easy for large stuffed macrophages to squeeze into. And also very important, this greater permeability of the lymphatic capillary makes it even more capable of draining all of that excess fluid that contributed to the swelling. And so this is when you start to notice the improvement in swelling. And something else that is also very cool is that as the lymphatic system drains this area, if there were, say, some bacteria that ended up evading and didn't get engulfed by the macrophages or the neutrophils, once they get pulled into those lymphatic capillaries, these lymphatic capillaries merge into lymphatic vessels that flow into little swellings called lymph nodes. And guess what's in there? Even more white blood cells to do any extra killing or filtration that didn't get fully taken care of at the initial site of inflammation. And we actually recently released a video on the lymphatic system that goes into even more detail that I'll link at the end of this video. But one of the last things I want to mention here is that you have likely heard, at least in the case of inflammation due to an injury, that you can help speed up this process with things like rest, ice, compression, and elevation, often referred to as the RICE protocol.